My name is Aisha Sagan, and these are my company pros and cons. First company is Cardinal Gibbons High School. Some pros is that it provides a very positive and supportive work culture and community. They also allow the opportunity to make a difference academically, socially, and spiritually in students' lives. Some cons can be that the pay, benefits, and opportunity for advancement may be limited. There's also potential issues with management, favoritism, and culture. The second company is Amaze ABA. They have a very positive work culture. They allow for flexible scheduling and staff support. They have a great reputation for being clinically guided and caring. They also provide mission-based services and evidence-based practices. Some cons for Amaze ABA is that the client cancellation and dropout rate can vary, which can directly affect your work stability. This is also an in-home ABA-based practice, so the work can be very isolating and demanding. There's also the possibility for high caseloads or high travel demands, which can contribute to burnout. Residential services is the third company, and some pros for this is that you will be associated with a nonprofit that has very strong values and a strong mission base. Staff also gets the opportunity to work in teams that includes RNs and mental health professionals. Because of this, there may be the opportunity to cross-train and specialize or grow in different directions. Some cons for this can be that the residential setting requires shift work, so you will possibly be required to work nights, weekends, or be on call for some hours, which can be very taxing. Residential care overall is just very demanding, and having to work with clients who have disabilities, medical, or behavior needs can be very emotionally draining. The fourth company is Element Endocrinology and Diabetes. Some pros for this is that they have a great reputation for good patient care, and staff can feel very proud and motivated by the work that they're doing. They also support both in-person and telehealth care, which offers flexibility in care delivery. Some cons is that because endocrinology diabetes is a specialty with complex patients, staff can face emotional and cognitive burdens. Also, some roles may have relatively low pay. The last company, the fifth company, is Oak City Counseling. Their pros is that they have clinical supervision built into their employment model. The clinicians also have more freedom to use varied interventions rather than strictly talk therapy. Some cons is that the caseload requirements may feel like a very heavy burden to some people, having to balance supervision, paperwork, and client care. Because they offer evening and weekend client times, clinicians are expected to work outside of normal business hours, which will affect their work-life balance. That's all.